Hello, I want to welcome everyone to our virtual panel event, Leading the Way, Exploring Careers in Public Health. I'm moderator Stephanie Malinenko, the Department Chair and Associate Professor of Health Promotion at Daemen College. Thank you for joining us for the 12th in our ongoing series of live virtual panel events to discuss current events, happenings, and hot topics. We welcome those who are joining us for our virtual event series. Thanks go out to our sponsor, the graduate programs at Daemen College, for inspiring this event and these conversations. I'd like to introduce everyone and have them identify their roles and titles. We'll start with Antoinette del Bell.
Hi, everybody. My name's Antoinette. You can call me Annie. I am a TV news reporter for WTKR. It's the local station here in Norfolk, Virginia, and I'm happy to be here today.
Next up, we have Ashley Giaquinto.
Hello, everyone. My name is Ashley Giaquinto. I'm a community health worker at Neighborhood Health Center here in Blaisdell, New York, and I'm excited to be here.
Thank you. Also joining us, Ryan Mulhern.
Hi, my name is Ryan. I'm the Public Health Educator and Public Information Officer for the Department of Health here in Wayne County. It's about 30 minutes east of Rochester, right up along Lake Ontario. And I've been here for 10 years and very glad to be a part of this discussion.
Thank you. Also joining us, Rachel Roberson.
Hi, everyone. I'm Rachel Roberson. I'm the Center Coordinator of the Children's Environmental Health Center located on Buffalo's West Side. Nice to be here.
We're also excited to have Omari Thompson.
Hi, everyone. My name is Omari Thompson. I'm a case investigator for the New York State Department of Health and happy to be here.
And finally, Brian Rotniak.
Hi, I'm Brian Rotniak. I'm the Director of the Master of Public Health Program at Daemen College.
Well, thank you all very much for joining us today. We're going to dive right in and get to our first question. So this question is going out to you all. I'm going to ask Brian to kick it off for us, though. And my goal here was to get your ideas and your definitions around public and community health. So what I'd like to know is, what does public and community health mean to you?
Sure. So public and community health has to do with, working together with the groups of people rather than at the individual level. And it's recognizing, specifically for me, that health behavioral changes, perhaps the greatest impact is on more upstream interventions that focus on things at the interpersonal, the society, the socioeconomic, and the environmental and policy level. And so addressing those aspects, as we know, chronic diseases are significant players in morbidity, mortality. 40 to 70% of all deaths in the U.S. are due to lifestyle factors. And so addressing these things through community-based approaches is really what public health brings to mind to me. I think some people know that I have a background as a physical therapist, and a lot of my work as a physical therapist, I grew more interested in weight control, weight management programs for kids and families, and less interested at individual level things. And it was really just exciting to me to see how powerful environmental strategies and public health public health and health promotion efforts can play in the role around disease prevention.
Great. Someone else want to hop in? What does public health mean to you?
Yeah, I know for...
Oh, go ahead, Omari.
Oh, sure. So I know for me, thinking about a lot of it has to do with promoting health and, advocating for healthy communities, but also a huge part, just being, preventing disease, as we saw, like with the, with COVID and everything, a lot of it having to do with preventing disease and early detection of disease, how people respond to infections and how people respond to infectious diseases and things like that, which we saw a lot, this year, really, this past year and a half. And so, and really how it all ties in together with having like a healthy community and how we all need each other to 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 make healthcare decisions, and how it's not just one person or one group of people, but how it's a community, and how pretty much how we all have to work together.
I agree with that completely. As a journalist, it's our job to be out there in the community, to interact with the community, and to put the accurate information out there. So it's important that I interact with all these public health professionals that are on this panel today, and just make sure that we're putting the most important information out to the public so that they can make informed decisions about their health.
Yeah, and I'd like to kind of build off of something that Brian mentioned, is as a health department that works locally, a lot of times you almost have to look at public health as a little bit of an ecosystem, all those different interacting concepts. It's not just the people who live in the community, but the community itself. How is it shaped? How is it built? Oftentimes we take a look at all of the different issues that might be happening locally. And as a matter of fact, every couple of years, it's our job to ask our residents, what do you see are the health issues that are happening, and how can we help you with that? Because public health, during the time that I've been with the department, has gone through this interesting shift from being a almost tertiary resource to being that preventative resource. There's a lot of times where we're discussing things not only with the community in terms of how can you prevent these diseases, but also helping clinicians and folks who are the people who would see these patients or see these residents to prevent disease before they even have to get into the door. And how can those physicians be a part of that prevention? So public health in general has really shifted to a lot of that education and prevention aspect. And again, a lot of those combining factors that play into everyone's health can be, a large ecosystem, like I mentioned.
Yeah, I just thought it was curious too. It's kind of related that the newest numbers on life expectancy show a continued decrease in the U.S. By 2 years. So we used to think 79 used to be average life expectancy. Health disparities, non-Hispanic, Black individuals, those rates are approaching over 3 years lower than the previous life expectancy. So I was going here with something. I forgot what I was going to mention in relation to this, but I think it had to do with the healthcare dollars and spending. The U.S. spends about twice as much as any other developed country, and as far as life expectancies go, we're not even close to the top. We're down around 54, 55, and so it really does speak to what Ryan was kind of mentioning, is that primary care and looking at primary prevention, health promotion efforts, things that help so that we're addressing conditions before they develop, and money spent toward environmental and social support programs could go a long way. The thought is that for every $1 that we spend, we could reap cost savings of $3, but unfortunately, we're only spending about 3% of the healthcare money on health promotion efforts, and just staggering numbers when we think about $170 billion annually around conditions such as obesity.
I think if I can jump in, I think, Brian, too, what you were kind of talking about going down the line, referring to maybe, is what I've noticed reporting in my reports. There's still these huge disparities among the African American community and the Latinx community compared to their white counterparts when it comes to healthcare. So I don't know if anyone can maybe kind of expand on that and talk about that, but that's the one thing that I've noticed too, especially during this pandemic. It kind of put a spotlight on all of that.
And I'm actually going to put a pin in it for a moment. I'm glad you brought it up, Annie, though. It is a question we're going to get to later in the panel and talk a bit about issues of equity and what some of our panelists are seeing kind of on the ground in the work that they do. Thank you so much for your, kind of really thoughtful interpretations for you, what community and public health means. because some of the goal of this panel is to introduce, the folks who are viewing us and watching us today into, ideas of what careers might be, I thought it was really apt, and I'm going to throw this one out to Brian as director of the MPH program here at Daemen, just to get, perhaps your thoughts on why you think individuals and, particularly prospective students, so young folks, don't know what public and community health is. Why has that perhaps been historically an issue, maybe in the field, or a challenge in the field? And how do we see that turning the tide, particularly in the last year?
Sure. So, I think over the last couple of years, there's been a lot of things that have come to the forefront around public health. And we think of, the vaccinations as one of the main things. And so people wanting to get into public health for that reason. Also, things like chronic diseases now that have been really increasing, or certainly at very high levels, I think have also called the attention to this aspect as well. And then further, I think the recommendation or the emphasis in healthcare money that gets spent on more upstream policy approaches, I think have also called into, have highlighted the importance of public health. Honestly, too, I think public health is quite a broad topic. And so it means, or could mean, a lot of different things and to a lot of different people. And when you talk about public health, I think some students might have, could have difficulty visualizing, well, if I get a degree in public health, well, what are some of the things that I can do with that degree? So trying to move it from the abstract to more tangible ways that we can, concretely use a public health degree. And this is certainly one avenue for doing that is getting the word out from, people that are on the panel that are actually in the trenches and doing really important work at the public health level.
Yeah, I agree. Something that for myself, being, last year getting my, master's in public health, even while I was in school, there was so much about public health that I didn't even know about, that I didn't even realize pertain to public health, like something as simple as, seatbelt laws, or, different healthcare policies and things like that. And things in terms of like the government level and so many different avenues of public health that I didn't even have any idea that even existed, and so, and kind of like, pinging back off of what Brian said, like there's so many different, avenues and it's can be such a broad topic, I think it's easy to miss what things, what public health really is. And I think especially with this past year, we've seen public health in so many different ways. It's almost become like a household name, like with COVID, it's almost like you can't get through the week without talking about vaccines or, somebody bringing up like an article or research that they heard, or whether it's true or not, like it's something that's so widely talked about now within this past year. But, I think in the past, it's something that can be easily forgotten, and whether it's like different laws or, different things in terms of government, it's public health is really everywhere, and I think one good thing that's came out of this year is that it's put public health on people's minds, and people are more conscious of their health.
I think to contribute to what Omari was saying, there are so many facets of public health, and I think that for prospective students, something to consider is that there's a piece for everyone. There are so many different avenues, whether it is, within community health, which is, where I'm at, in outreach endeavors, social supports, whether you're working at the county level, different things like that, environmentally speaking too, that there are just so many different avenues to kind of expand on. So I think that it's also important to note for prospective students that, if you're interested in one, there's definitely many opportunities in different avenues as well. And to Omari's point, if one thing has come from COVID, it's really really outlined and put public health on a platform to be able to have greater conversations about the healthcare disparities that were within our communities prior to, the pandemic response. So I think that that's really important to note as well.
Thank you so much, both Omari and Ashley, for bringing that up, because that kind of pivots really nicely into what we wanted to talk about next. And so I wanted to throw a question out to Ryan, who in part of his role at the Wayne County Health Department is the public information officer. And so he's responsible for a lot of the communication, or almost all of the communication, that comes out of the Office of the Department of Health in his county. And so I was curious to know how his view as a public information officer, how the recognition of what public and community health has changed over the last year and a half because of the pandemic.
Yeah, I was just thinking about how the last couple responses were setting this question up really nicely, because I always kind of make a couple maybe terrible jokes about public health. One of them being that if we're doing our jobs to the best of our ability, you don't really know we're there, right? Because we're staying on top of things. We're staying out at the forefront of some of these issues that might, pop up in different communities. But then I also make the joke that last March, public health just kind of appeared for everybody in the world. Nobody really knew what we did, and then all of a sudden, everybody knew what we did. And with that, of course, a lot of people had opinions on how we did what we did. But I do actually think that there's been a greater benefit to everything that has come from that light shining on public health because of the pandemic, because it's given people a little bit of an insight to what people like myself or the nurses who work in our department, or even our case coordinators who work with, say, like our early intervention services, which help provide services to children who might have developmental issues that we can try to address and catch early. Those are all of the things that a public health department does and is always thinking about, taking into account, how does this affect the community? Where do these people maybe necessarily might need some of those services, or some of the things that we can work on that might be different, from one end of our county to the other sometimes. So it's really awesome for us to have that ability to put out there, this is what public health does, this is what we're doing. Now you can see it, but this is still only just one part of it. This is still something that, even though a pandemic is a big deal, the communicable disease monitoring that we do for this is something that we do for tons of other diseases that can go around on a daily basis that do not contribute to a pandemic. So the processes involved with how we look at a case, how we follow up with a case, is something that's always been there. And now people are seeing it for the first time. And it's a bit helpful in the sense, because it might give them a better idea that their health department can be there for them for more than just how do we affect COVID numbers in our area.
And thank you, Ryan, for kind of really giving some insight into also some of the other things you do, which you guys will have plenty of time to talk about. I want to actually build on a little bit of what you said and address the next question to Annie. As a reporter, we just talked a little bit about kind of information that goes out there and making sure that, what does public perception look like? So as a reporter, what are some of the things that you've seen, particularly over the last year, but even, broader than that in terms of perceptions and understanding of community and public health?
Well, certainly a lot of our job has changed because of the pandemic, but from what I've seen, there was a lot of misinformation that was being put out to the public, whether it be through social media. Even still today, there's a lot of misconception when the pandemic hit early on, and even now up to this day, there's still people that believe the vaccines, despite what doctors say. are not safe. So there's just a lot of community members and physicians who are trying to dispel those myths, and individuals like myself try to help put that message out. But the public relies very much on where they get their news and how they get their news, and just trying to be that person as a journalist and give them their news in the most timely manner and the most accurate, information, again, so that they can be informed about their health. I notice now, like even today, I mean, people are so much more comfortable now with getting out there because a lot more people are getting vaccinated, and that's really nice to see. Just the community coming together and life kind of starting to look back like it's normal again, pre-pandemic. And it just, there's still a misconception though about mask wearing that we've seen, but it's just been nice to report on those feel-good stories about community members stepping up to help one another. This person lost their job. So, the community coming in and rallying together and trying to help a person in need who's maybe fallen on hard times, who's never been in that position before. I had just the other day a story about two sisters who found just a random tax return check, somebody's tax refund, just outside of a mailbox lying on someone's lawn. And instead of bringing it to the post office, they hand delivered this person's tax refund to his door. And he was so grateful because he really needed that money. His wife had just died and his son had just moved back in. So it was just a really heartwarming type of story that we get to tell. So it's just, for me, it's just trying to highlight those stories in the community. And like we were all saying, public health can come in so many different ways, and people kind of need these feel-good stories right now. But I don't know. I'll leave it to you, Stephanie, to kind of pivot if you want. If I didn't answer that how you wanted to, but that's kind of my perception.
Thank you, Annie. I think Ryan had something to add.
Okay.
So it's interesting, to be able to add the perspective of somebody who has to develop that message that you then, Annie, convey to the public. And even I think you might have mentioned before that up until recently, maybe even we had kind of communicated directly on a couple of those messages. But it's always interesting from my end of things to have to think about, okay, so what is the solution, or what is the message that we need people to utilize? And then how do you wordsmith that just right to be able to get that message across to people? Because as you mentioned, there's a lot of misinformation out there, or there's a lot of information that sometimes you can take the same thing. I could hear one thing and someone else could hear the same, but we might understand it differently, or we might interpret it differently. So one of my jobs is to really look at exactly how to word something so that it conveys that message correctly without getting it lost in translation. And that's a really big deal right now, to be able to convey that information well. So having a good working relationship with media personnel, having a really good working relationship with the people who will then disseminate that message that I can provide to the community is so crucial, not only just for COVID, but for any of the health issues that maybe we might be looking at, or the challenges that we might be trying to address.
Well, and from a public health perspective, public health communication is an entire field within public health that, folks can explore and can look into if there's passion and interest in communications, that, that exists as well. Omari.
Well, sure. And, just to piggyback off of what Antoinette was sharing, I think it was so amazing seeing how communities, really work together during this time, where, let's say somebody was, at home, or, they had COVID, or just had a quarantine, being able to see someone, even get help from their family or friends, during that time. Because, you have COVID, you have to stay at home, you can't go out, or you can't, take your child's at home, or can't go to work, or so many things that you used to be able to do, you just can't do. So I think it's so amazing seeing let's say a family needed food, they couldn't go to the grocery store, seeing how, a family friend would be able to bring food over to that person's house, or if they needed some kind of medication. There's many people who had COVID were elderly, and those people, a lot of them were sick, and seeing how people work together to get those people medication or things that they needed, that they would normally just be able to freely get. So I think really during this time it was really amazing seeing how people, like, community really came together and helped fight this disease, that's together as like a community family.
Thank you so much, you guys, for sharing. We're going to take a brief break for a message from Daemen's Graduate Studies. We'll be right back.
Daemen College, we strive to help every student reach their educational and professional goals. With exceptional resources and one-of-a-kind learning experiences, our graduate and professional programs will put you on the right path to career success. Our graduate programs include applied behavior analysis, education, nursing, social work, and more. 7 of our 11 graduate programs are open to any undergraduate major. Explore our graduate programs today by visiting daemen.edu/graduate.
We are back and on to the next series of questions for our panel. So I promise we're not going to dominate this entire conversation with COVID or coronavirus related events, but given that it has also dominated our lives for the past year, there's just a few things I did want to touch on. So public and community health are no different than any other health professions, particularly, direct health professions we might think of, like nursing and doctors, and as Brian mentioned before, physical therapists and other allied health professions. In terms of the need for empathy and compassion when working with communities and with individuals. And so I'd like to actually ask Omari this next question on how, that idea of needing to really embrace compassion and empathy, how has that come to light in terms of the work that you've been doing with COVID in your job?
Right, yeah, that's a great question. I know for us, dealing with a lot of families, pretty much all the families who've had COVID or had to quarantine, and a lot of people they're going through a rough time. You can imagine having a disease that you've never even heard of until this past year, getting that disease and seeing so many people in the country have died from this disease and getting it. It could be extremely stressful, for you and also for people in your family. And I remember one specific conversation where I was talking to older woman, and her husband actually just passed away from COVID, and she had COVID actually, and you can imagine that being an extremely rough time, for her and for her family. And it was during a time where she needed, you can imagine, losing your husband, someone you spend most of your life with, like you would want to be around family or friends, other people, but she had to isolate since she had COVID. She had to be at home by herself, and she wasn't able to be around her family or friends, or have that love or encouragement, in person love or encouragement from those people that could really give that to her. And so one thing that I had to learn was really meeting people where they're at, and really being able to understand, like, wow, this family, they're going through an extremely rough time, and obviously I know we're supposed to get specific information from them and investigate where they've been and all that, but sometimes what people needed was just the ear, just someone to really listen to, or because that alone, that's part of public health, like just being there to encourage someone, and whether maybe even linking that person up with if they need some mental health services, or wherever it may be. A lot of times it was just being a good listener, being able to encourage that person and help them get through that extremely challenging time. And so that's something that we've had to see a lot of this past year, and it's encouraging being able to help someone through that, knowing that wow, like this is probably one of the hardest times in that person's life, but being able to be that ear, or be that that call that can, help them or encourage them during that time. That I think that means a lot to a lot of those families.
I also feel, kind of going on with this topic, as a community health worker, we're unique in the sense that we kind of act as a conduit almost between the community and healthcare, social support access. And COVID has been difficult for everyone and has really put those disparities and just accessibility to healthcare in general difficult. So having to utilize different methods to still reach the same patients that we were seeing constantly and really responding right away. That's another thing with public health is that we have to be flexible in our work, and that things can change constantly, and we have to sometimes work on the fly. And something that I think we were able to utilize well here in recognizing that not all of our patients have, access to technology for telehealth visits and telephonic visits, actually going out and doing outreach into the communities, bringing, initiatives to the people that we're serving. And that actually has made such a difference in, patients receiving care, and to know that there are people out there that are working really hard to try and, work with everything that's been going on, and then continue to make things as normal feeling as possible. So I think it's really just a testament to everything that everyone's been doing.
Rachel, did you want to add?
Sure. I just, to speak to having empathy and compassion, that's crucial in our work. And especially throughout COVID, I've seen a lot of great community efforts being organized by, the folks in the community themselves, seeing shortcomings from, the government or other agencies due to just being overwhelmed. And taking that on as, their own problem and responding to it and just working together and coming together as a community. So I think it's also important just in the field of public health to always remember, like, we are working, with communities, not for, and that this is more of a, solidarity and not charity. The communities have the resources, they have the knowledge, they just, need help in bringing that together and having that be heard by the greater, decision makers that be. So I think that's just an important part to lift up too, that we are the experts and so is the community. So.
Excellent and very well put. Absolutely. So we had a question come in from the audience that really tied into something I was going to ask anyway. So the question that came in that said, of course, events, like COVID are important challenges that public health experts need to address or triage. But does it ever feel like a distraction from the big picture you'd rather be advocating for? And we had a question planned on, post-COVID, what are you looking to kind of sink your teeth back into? What are the issues you'd like to be able to get back to? So I'm going to throw it out to Ashley and then open up to anybody who wants to respond. What are you looking at, post-COVID on being able to focus on again?
Yes, this is a great question. And, as mentioned before, it's definitely about being flexible, but, moving forward is also part of the process and looking forward. So for me, a lot of the work and initiatives that I'm looking forward to diving back into include a lot of advanced care management. Here, we have a population health department. We've been working diligently with patients, some of our higher risk patients in our medication assisted therapy programs, our homeless patients, and our high risk diabetic patients, and just providing, like I said, that accessibility to not only the healthcare that they need, but also the social supports aspect of that. So, a lot of the work in these initiatives is to help bridge the gap for the people that are left out of those traditional medical models, and really focus on the social determinants of health and those assessments that you get to do to lend support and really identify needs within different populations within different communities to better assist with that. So I'm looking forward to really assisting in that realm again, and additionally have been able to work with the Say Yes Buffalo program and OSHI, as well as Planned Parenthood. We have a mobile medical unit that we are actually have started up with our pediatric patients to make sure that we're getting them the child checks and immunizations and things that they need for school. So really, there are many opportunities, but I'm really excited to jump back into those programs.
Yeah, I just wanted to comment that, certainly COVID is a challenge, but it also brings opportunities. And one of the things that I think of as someone that advocates for, physical activity and nutrition is that I think actually, the COVID has actually brought about opportunities for some families to be together more, to be outside exercising more. It was very difficult for me to buy a new bike that I wanted, but we were doing hikes and camping and outdoor activities, also making meals together. So I think there's certainly going to be other pandemics in the future, and so this one gives us an opportunity to kind of prepare for other things. But obviously, in public health, you can't be an expert in all areas, but around physical activity and nutrition, and then the technology that we do have, where we can interact this way, provides new opportunities to share public health messages around physical activity. And from that aspect, I thought it brought about some learning opportunities for us.
Ryan, did you want to jump in with some thoughts?
Yeah, I definitely wanted to add that I think there's a very common perception amongst the public what public health does during COVID, what we do from where we come into play to whether it's guidance on how to handle certain situations, and then exactly how do we handle each case individually. But I think that it's important for people to understand that there's nothing more than getting back to normal, or getting back to being able to work on all of the things that public health did prior to COVID, is something that we really want just as much as everybody else. I think there's a lot of COVID fatigue out there amongst people, but I don't think they quite understand how fatigued maybe their local health departments might be as well. And to address that question, what do you feel like the big picture might be? For us, it's being able to get back to provide some of those services that we've always been providing and always been able to do, whether it's, we have certified lactation consultants in our office who can go and do, we have something called a baby cafe, where we help mothers who might be having issues with breastfeeding, and we're promoting breastfeeding because of the impacts, how strongly they impact, future health promotion for that child. So, programs like that are something we really want to get back to being able to do, because they make such a large impact, but they might not have ever been noticed until they were gone. And now that they're missing or maybe not able to happen, especially because our department is quite small. We have a county of about 100,000 residents, just under 100,000 residents. And there's 18 of us who have been working through COVID and handling every single case. And at one point or another, we had over 550 active cases, which require a daily call from one of us. And there were 18 of us doing those calls. So actually even less. So from the big picture, getting back to being able to advocate some of those other programs that have always existed, whether it's the baby cafe, or I do smoking cessation counseling for people. These are impactful programs that we want to be able to provide, and they never necessarily went away, but we had to adapt them. And we want to be able to get back to doing those things, whether that adaptation stays or we kind of do maybe even a little bit of both and get back to the way we did them before, as well as offering some of the things that we've been able to keep going with.
Yeah, I think that's a great point, Ryan. And some things that I'm looking forward to are just those services that we provided, pre-COVID. Some of my work is based in food insecurity and barriers folks experience to accessing healthy food. And so this summer we've been able to start back up with our farmers market located at the pediatrician's office, which has been great just to be in community and these problems didn't go away. Food insecurity actually increased by COVID. So being able to just be back in the community and give back in these ways that have been, needed extremely. It's just very, it's a fresh air, breath of fresh air. I think public health a lot of the times can be, doom and gloom, but there is a lot of efforts to, help achieve health equity.
Thank you, Rachel. Omari, did you want to add anything?
Sure. I think one thing that's amazing that with everything with COVID and now everything's slowly but surely getting better is that we've so many there's so many different public health things that tie into COVID, kind of like what Brian was saying earlier about families are able to spend more time together and I've heard so many stories of how families they've been able to spend more time together, more time than they've ever had before, or things like that, and just being able to people, it's cool because it gives people an opportunity to get more excited about their community and you know more community engagement just from not being just from being inside for an entire year. And I think that opens the door to so many other public health avenues, whether it's exercise, and whether it's thinking more about health, or thinking just in terms of thinking more about public health in general. So I think it's amazing that through this disease it's opened up many other things that that we do advocate for in terms of public health.
Excellent. Thank you so much. I'm going to throw the next question out to Ryan, but this is also, open to anybody who wants to answer. What do you think are some of the most pressing community and public health challenges that we have on the horizon? So if we can pivot away from this, pandemic, and we are, what are some of the, some of the more pressing and, I guess I say challenges, which almost makes it seem kind of negative, but also opportunities where public health can really step in? What are some of the things you see on the horizon where you see a lot of the focus for public and community health going?
Yeah, certainly. It's funny because I think to myself about all the different areas that public health interacts with the community, or public health interacts with looking at someone's health picture as a whole. And a lot of times I think people think of public health as this is where you go to get flu shots, or this is where you go to get your animals up to date on their rabies shots. But one of the challenges that we've seen, I think, come to light, and it's been on our radar for some time, but it's certainly come to light throughout the pandemic a little bit more, would be the challenges that you see with the mental health side of things. We want to be able to address adequately the community's need for not only their mental health, but advocating those resources that maybe have always existed in our area. We have wonderful resources here in our county that can provide, mental health assistance that I think a lot of the residents maybe have either they know about, but don't really know how to get connected with. And that's where public health can really come in, especially as the health educator. It's my job to not only find those ways to reach those people, but also create the pathway for that connection. And we're also looking at somewhat on the mental health side of things. Some of the crisis surrounding opioids has certainly been on our radar for some time as well. We're really looking at how can we address helping people overcome that opioid addiction that's creating and driving some of these rising overdoses that we're seeing. The overdose rate, not only throughout the pandemic, but prior to the pandemic, was also rising. So, we have always got work to do in public health. And that's something that I think is really important for people to understand, is that it's it's almost a year by year thing that we look at and we say, what do we see that's happening now? What can we actually do about it? And we're really blessed to be, despite being a rural community, a county that has a extraordinary level of collaboration amongst other amongst other departments in the county, amongst other agencies that exist. Our Cornell Cooperative Extension locally does a lot of great work, not only with the food security issues that were discussed prior, but just generally the nutrition education that we can provide. And how do all of these agencies, how can we all come together and say, look, here's an issue that we want to work on, and let's actually make a measurable impact on that issue. And of course, like I said, those challenges, they don't stop existing. They just keep changing. And it's public health's job to try to see that change, sometimes even predict that change a little bit, and then work on getting out ahead of it so that we can prevent it from becoming a negative impact on the community and health as a whole.
Thank you. We had a question come in from the audience that I'd like to throw out there because I think it's also relevant to what we were just talking about, particularly in terms of the work that you all do. So the question that came in that said, with all the changes that COVID has brought in your fields, did any of you find that it impacted the area of public health you see yourself in the future? Do you have new focus areas or new goals through what we've all lived through in the past year and a half? I'll throw it out then. So go ahead, Annie.
Speak on interviews I've done, people I've spoken with. There's been a new term coined called the pandemic pivot. A lot of people have switched careers just because maybe their jobs were no longer needed or put on hold because of the pandemic. So certainly there's been a lot of career changes and a lot of moms making different decisions about their careers and staying home or doing something that they can spend more time at home with their family, fathers as well. So I've seen that a lot. I've reported on it a lot. Some good stories, some sad stories where, people haven't been able to get back into the workforce because of whatever reason. Some of it is because they are the one responsible for their family and they can't find another job that would allow that flexibility. So certainly, also, I totally lost my train of thought, but there's been so many people who've done that, and there's been more time, I guess, for people to learn new skills to get better jobs or different jobs.
Yeah, I agree. Antoinette. Like, there's, even for myself, working directly with, the health department with COVID, and with things getting better, we're technically right now under a contract with the health department. So since it's kind of bittersweet, since things are getting better and, like there's not as many cases to call and things like that, our contract does end. And so for us, it's bittersweet because, it's an obviously, we love our job. We love helping people and talking to those cases and getting the help and everything that they need. But also, that means, obviously we have to move on to the next thing, which is great. Like, it means like we did our job, we did what we were supposed to do. Now it's what's next. And so it's a great opportunity even for myself, being able to, I feel like it's such a great time to be a public health, to have a degree in public health, because it's, so many new things are popping up, and being in the Western New York area or whichever area, you are in the US, it's an opportunity to, seeing what's out there and being able to use other skills that I've gained, through working with the health department in a different avenue and focus.
I think that, if anything, it's provided opportunities from, I guess, an institutional level to really evaluate the efficiency of the way that we actually implemented initiatives during that time too. I mean, we talk about diffusion of innovation and the technology with telehealth and how we were able to just have such a quick turnaround with, telephonic visits and trying to, figure out a way to get our patients to, get the healthcare that they need during such a crazy time. And that actually led to a digital divide program where, there are community health workers that, their focus shifted completely in reaching out to patients, establishing the Zoom and going through how that works. And, now we have these digital divide kits. So even, if a patient has access to the technology, but they don't have materials at their house like a scale or blood pressure cuff, things like that to get vitals, it's not going to be as beneficial. So there's this whole host of different initiatives. So I think that if anything, it's really allowed us the opportunity to evaluate the way that we implement initiatives and, just be flexible to that change and try to be, as on point as possible. But, we all have done the best that we can and we continue. And to Ryan's point, it's a very active process. Public health doesn't, just come in and out. It exists all the time. Disparities, disease prevention, it's all happening whether it's recognized or not. So it's just kind of understanding that it's a very active process.
Yes, that's a great point, Ashley. And just to echo what you've said, throughout the pandemic, inequities have been made very clear. Not everyone has access to technology, whether it be for, healthcare or learning. So if anything, the pandemic has sort of validated my focus on health equity in all facets that it exists, not just healthcare, but if it's in the school and learning, I mean, it's a whole person, whole community. So yes.
That's a great point, Rachel, and kind of pivots right into what the next question was, which I was going to throw to you anyway, because I do know that's a lot of the work you do, and also a lot of your passion within the field has come from exploring and problem solving around some of the inequities that exist within communities. And so we are seeing these become more, I think those of us who work in community public health have always known that they've existed, but they're more publicly becoming acknowledged these days, and the connections that are being made between equity and public health. And so I just would ask if there's anything else you wanted to add on some of those intersections through the work that you've done, or where you see some of the greatest opportunity perhaps to address some of those inequities.
Yes, great question. So for our audience, health equity is defined as the absence of unjust or avoidable differences in health. And these are usually rooted in the isms that we know, right? Like racism, sexism, racism on the base of education and income, gender identity, sexual orientation, disability or different abilities. And this has sort of been made very clear throughout the pandemic. But as Stephanie had mentioned, these problems have existed for centuries. And so the majority of my academic work was focused in maternal and child health and just the inequities that we see in those outcomes. For example, Black newborn babies are twice as likely to die within their first year of life compared to white newborns. And I would also like to uplift that this is not genetic. It ties back to the social determinants of health, where we work, play, learn, and live, and the influence that has on our health. These inequities are largely structural and political. We see that in barriers to adequate care, healthy food, safe and affordable housing, and they do not always stem from individual choice. So I would like to make that clear too. But the goal of public health is health equity, right? Like we always say, we want to work ourselves out of a job. So to think that, I think we need to, name racism, classism, sexism, all of the isms, and just move forward. Like it's time for us to move from understanding, which I think a lot of us had, have time to sit with during the pandemic, and move to solutions and how we can really begin to respond to this issue.
Does anybody else have anything they want to add in terms of addressing, some of these issues of equity, or looking at some of the things that you've worked on that might get us to that point? Ashley.
I think that to Rachel's point, a lot of the work that is done in public health in addressing, social justice, in addressing, inequities in healthcare, whether it's based on, race, gender identity, gender education, different things to that extent. I think that it's, in order for us to continue to move forward beyond just understanding, it's intentionally utilizing, the diversity and equity, inclusion, that justice in our work every day. And one of the things that I have to say here at Neighborhood Health that we have started to transition into, we have an equity advisory committee, which I have the opportunity to sit on with many of my other colleagues, that really look at things from an institutional sense, to look at the history of, particularly our health center and the work that we've done, and how do we intentionally bring inclusivity and, that sense of diversity and justice into our work, so that we can, practice what we preach, essentially, as healthcare centers, because it's all well and good to say that, we are inclusive and we promote, equities in healthcare, but if we're not acting intentionally on that within our work, then, there's more work to, and it's a constant process. It's not just, you don't get to a certain point and, it's, debate between like cultural competency versus, the verbiage, even having that acknowledgement as well that, you can't attain a certain level of understanding. It's a constant process, and it's something that, as public health experts and people in the field, that to transition that to the greater public, and understanding that even verbiage matters.
Excellent. Thank you so much. I think, we would all agree, things that we've learned, not just in this last year, but over the past few years, particularly in the public sphere, is that words matter, and how we say things. And again, the intention in which we do so really can have an impact on what we're trying to accomplish. I think that, and I appreciate both Rachel and Ashley, speaking to some of these issues, and knowing that, the American Public Health Association officially declared racism as a public health issue not that long ago. And those are big strides at that societal level that need to happen. But there's so much work on the ground that you are doing, all of you, in making sure that we, kind of continue to have that dialogue and look at issues of inclusion. So often, the solutions to public and community health issues require a lot of creativity. And I think we've seen some of that illustrated already today, but I wanted to put a question out, and I'll put this out to Ryan, and again, anybody else can jump in as well. But is there an initiative you've worked on where you had to be especially creative in your approach?
Yeah, so I'm gonna throw you a curveball with my answer and say that everything we do requires creativity. It's interesting how, when we look at a specific initiative, whether it's reducing, say, tobacco use in our county, or even more recently working on the vaping side of those things, some of that creativity might come into play. For example, with me, say, I might reach out to the local school districts, principals' offices, whoever I can get a hold of, and say, how can I come in and maybe talk to your students, or address this with your students, and get this nipped in the bud, so to speak, before it becomes a greater issue. But really, the example I wanted to give for this would be tied into, I alluded to earlier about how health departments have to do what we call a community health assessment We do those every couple of years, and then we have to submit a community health improvement plan to the state that addresses the areas of concerns that are identified to us by our county residents. So essentially, we do a survey, and that survey needs to reflect an accurate representation of our county's population. And if we find that that survey might be lacking in areas, maybe we didn't get enough responses from men of a certain age or people of a certain race or ethnicity, then the creativity comes into play, because we need to get that answer from those subgroups before we can now use those answers to create that community health improvement plan. So oftentimes what we'll do is we'll get creative in ways that we can reach out to those groups. Our go-to is usually to host some sort of focus group. And maybe we might attack that focus group challenge by going to a local church where the population within that church is reflective of the group that we're trying to get more information from. But a lot of what we do for public health is tell us what we can do. We don't tell you what we think you should do. So we take that information from the community, we look at their responses, and then we say, okay, these are the issues that our residents are reporting to us. And our residents can be so different from one end of our county to the other, depending on different things, whether it's socioeconomic status. There are more affluent sides of our county than the others that are much more rural. We even have a large Amish and Mennonite population that we even have to address. So how do we get our information out there when so much of what we do these days is through either social media? We do a lot of Facebook Live or Zoom discussions to try to reach people in ways that we can't necessarily do in person, at least for the time being. And so the creativity on, okay, here's a problem, and how can public health address it, is really what drives that pathway, to use a term I used earlier, when we create that community health improvement plan and we say this is the way we're going to address this and this is how we're going to measure it. Now let's get creative with creating that roadmap.
Thank you so much. And again, I think this bridges nicely with, creativity and problem solving that you all did as students when you were on your path to working in community public health, and transferring those skills out into the work you do now as professionals. I'd like to throw the next question to Rachel and ask, what has been the most rewarding aspect of your community and public health career thus far? I know it's loaded.
Yes, very loaded, but thank you for the question. The most rewarding part, I would say, is just working with and in community, seeing all of the great work that's being done and just being able to be a part of that. Like I said before, I think a lot of times public health can be doom and gloom, but there are so many community efforts that are being led by valued members and leaders who have been doing this work for years, to respond to the different issues in the community that we see in public health. So being in community is rejuvenating, it's inspiring, and yeah, for me, it's my favorite part of the work.
Thank you. So in thinking about, again, the work that you do and reflecting back upon your time as students, whether as graduate or undergraduate students, and many of you, because, I know many of you students who may have questioned what you were doing in the beginning or really unsure and came into this work, not always, as we talked about early, directly, students don't always come into college knowing what public and community health is. But all of you, kind of eventually found your way there. And then, I think in your time as students, you often sought out connections, as Rachel had said, with community, or opportunities for things like, professional development. And I know, Ashley, I'm gonna put this to Ashley because I know she has some experience there. But can you give some suggestions for some of these types of activities, whether they're, professional development or community connection activities that, either current or prospective students might want to engage in, that'll help them move forward, in either discovering their career or making advancements in it?
Absolutely. I mean, when I first transferred into Daemen, I was actually in the athletic training program, and back then it was the healthcare studies prior to the switch to health promotion. And I found a passion in community health. And so I would say for any current or prospective students, utilizing resources on campus that are available to you. We have a career services center, which prepares you with mock interviews and workshops for resume building, things to that extent. The career and internship Expo is actually where I met Neighborhood Health Center. And as somebody that never had a job in the field, that was a very daunting thing because, you want to be able to get a job on the ground and in the field, but sometimes not having that experience, it can be a little discouraging. So I would just advise that, even if you feel a little bit hesitant about that, to definitely pursue it. Professional development course, internship opportunities. I know a lot of professors in the program have students actually present presentations on different organizations in the community. And a lot of the work that we do as well is the networking and touching base with the community members and different community partners. So I feel that if, the students take advantage of the resources and, recognize that the classes that you're taking are beneficial for you and will provide you with those, that foundation to be successful. And, I know a bunch of alumni that are always willing to, be in contact with students if needed. And if there's something that somebody doesn't know, there's, your professors, advisors always know somebody. So definitely take advantage of that.
Thank you. Maury.
Oh, yeah, actually, that's a great point. I was thinking the same thing. I know, I think internships are great. I feel like that really helped me. When while in school, like getting my undergrad in community health with the healthcare studies program, there was I was able to intern with the health department, and it was interesting. There was like a harm reduction program, giving out like Narcan, for the community, and like with, and also another internship with like syringe exchange program downtown and Evergreen Health Services, and and I think that's one of the things that helped me to realize, like, wow, I really like public health. I want to go. It made me think about how I learn more about public health, and that's when I made a decision to go back, and go to grad school for a master's in public health, and so, but I would have never known that if I didn't take those times to do that professional development and do those internships and put myself out there and see what I liked or what I, didn't like, and things of that nature.
Thank you. I think, again, these both really illustrate, kind of important avenues that students can take in terms of kind of growing their own networks and really that discovery piece. We talked earlier about how, again, students don't necessarily come out of high school knowing what public health is or having heard the term public health, although, again, over the last year, I think some of that has changed if there's been any attention paid to the news on this. But even within that public health is so broad and so wide that there are opportunities to really look at ways in which students can engage with communities and learn more about what those needs are, whether it's through volunteering or whether it's through actual, credit-bearing internships, whether it's, getting jobs kind of early on, all of that, especially, and I tell students a lot, jobs that they might not think are something they want to, explore at this time or something they're really interested in, that you take that opportunity and then you see where that leads you. And I think, you guys are all really good examples of that. The notion of the days in which people, found employment and stayed there through retirement don't really happen now. And folks change jobs every couple of years. And that's really, important. And I think that, there is, again, opportunities for kind of spreading, those messages, and figuring out what those opportunities, might be, and learning more about them. And, I think, even, Annie, in your role, as a news reporter, you've probably learned more about public health in the last year than you ever maybe wanted, to know about. But it's also hopefully provided you with avenues to, kind of look at your own experiences and how you've learned, on the job, as well, and the ways in which you can contribute to that, kind of good, positive communication that's so needed.
That's so true. And with any story we do, we kind of have to be like a quick study, and make sure we know the facts going in and ask the right questions and whatnot. But this year alone, like some of the things that I had been reporting on in the past, even before the pandemic, I didn't even realize were public health related. I knew that we were doing an important job as journalists and getting the message out there, and highlighting certain studies, like studies on how to quit smoking, how marijuana perhaps can affect somebody, and how can that impact somebody, driving on the road and speaking with a mother and highlighting her story, maybe of loss or something. So really, really good stories that I'm looking forward to maybe getting back into once the pandemic kind of goes away. I don't know if it'll ever really go away. These stories are always going to be there. There's always going to be stories about somebody impacted by this pandemic that we're going to highlight even now with long haulers and whatnot. And to talk about, stories about loss and maybe the stories that we really haven't heard. But it's really rewarding to touch on those stories, especially, the feel-good stories. I remember one story early on that I did where a group of local nurses at a hospital helped this one dad who was deaf, and he wanted to be part of the experience in the delivery room with his wife who was about to have a baby. And he couldn't really communicate with the nurses because of the mask, and it would cover up his face and the nurses' faces so that he couldn't read lips and whatnot. So these nurses kind of got together. They had a sewing machine. One happened to have a sewing machine in the hospital where she sewed these different kinds of masks and made a clear panel in the front of the mask so that this dad, and they can all wear these masks so he can communicate and be fully part of his wife having the baby. So it's really great to highlight those stories so that it'll maybe always have a connection in these several months going forward. But I'm just looking forward to highlighting those other stories that are out there and helping all of you experts, getting the message out about different things that you're doing.
Great, thank you. And again, I think underscoring, this idea that public health is everywhere. It's in so many facets of daily life for each and every one of us. And we just don't necessarily recognize that or had needed to. And I think too that kind of brings us back to some things that some of our panelists said earlier, which is, public health had always been in the background, and for many of us, it's been okay. We're okay working in the shadows a bit in the background, doing, kind of that really good work without everybody realizing that it needs to be done, and that's okay. And so for some of you, kind of getting out of the limelight might be something you're looking forward to, and getting back into really working on those super important initiatives. And I love the story you just shared about the mask, because I think that also kind of ties back into the question that Ryan answered before about needing to be creative. How do we get creative in our approaches to working with folks and working in communities, and whether it's, again, accessibility in times of crisis, or whether it's just, being inclusive in the way in which we, even ask what the questions might be, and what the issues are. public health is about those, that idea of community first, and being, inclusive, and being open to, again, new ideas and new creativity, and flexible. I think Ashley mentioned earlier about having to be flexible. I think, again, if anything, the last year has taught us that flexibility is key. But public health folks, you're always flexible, right? It's always fluid. Things are always changing. And I think, to kind of lead us into our final question, because we have about 10 minutes left, and I want to give each of you time to answer this. But I think that, in terms of advice you might give, some of that might be about having to be open and flexible, and know that you want to be in a job where not everything, is the same. So if you had the opportunity to give advice to a young person who might be thinking of pursuing a career in community and public health, what advice would you give them? We'll start with Ryan.
Sure. So I was thinking about how I might answer this, and I kind of think the best way to convey what I was thinking would be with a little bit of a personal story. So I initially started at Daemen with the goal of being in the physician assistant program. And unfortunately, during the first year I was there, my father was diagnosed with cancer. And eventually he ended up passing away from that cancer while I was at school. And during the time off that I took before I came back, I started really thinking about how I wanted to make an impact that would keep people from reaching the point that me and my family had just gone through. So I really started pursuing the idea of how do I address, or how can I learn something and go into a field that would allow me to do such a thing. And public health jumped right out at me. I have to especially thank also Justine Tatuska for being a great advisor for when I came back, and really kind of helping me ground my feet again. Because anybody who might be looking into doing something in public health, I think you have to go into it with the mindset that you want to be impactful, not only for yourself and for your community, but with the idea that you are able to make measurable impact for that community. And if that's something that appeals to you, if that's something that drives your ambition in any way, public health is the place where you can do that. It's a great place where you can combine that ability to communicate and interact with not just small specific groups, but also a community as a whole, a county as a whole, but still work in that healthcare field and be able to work in that passion. I was always quite passionate about being able to do something within healthcare. So finding the mix of being able to create that impact that can help drive better health outcomes, being able to still stay connected and see the fruits of that labor, became very clear that public health was the direction for that. So I very much encourage anybody who likes to have that passion of impactfulness to think about public health as an avenue for that.
Thank you, Ryan, and thank you for sharing, your story. I think it probably resonates with experiences, even if they weren't exactly the same, that a lot of young people go through. Rachel, what about you? What advice would you give for students who are thinking about a career in community and public health?
I think Ryan highlighted a lot of important things about public health, just the fact that we are an upstream approach. So the idea of you see people in a river and they're flowing down the river, and downstream approach, medical care is the ones taking them out of the water and helping them, making sure they don't drown. Public health is going to the top of the river and figuring out why these people are in here in the first place. So I think if that's something you're interested in, finding the root cause of a lot of the concerns in the community, that public health would be for you. I know this field is super vast. I mean, there's so many facets. So I would say just find something that you are interested in, something that you're passionate about, and dedicate yourself to that work. Find organizations who missions resonate with you and explore that. And I think in the end, you will be surprised with how rewarding your work can actually be.
Thank you. Omari, what about you? Advice for young people who might be thinking about exploring community and public health?
Right. I love that. I love that analogy by Rachel. Like it's really, seeing those people like upstream and realizing that, it is a vast field. I know for myself when I first, started school like years ago, like I wanted to do, physical therapy, which, it's a great field. And I have tons of respect, for physical therapists. And, but then realizing, you know, getting more into like the field and diving into some other classes, I realized like, like public health, community health education. That's something that I'm really passionate about, just because it's so many different avenues, being able to help people in so many different ways. And even for myself, job searching now, like I said before, our contract with the health department is ending. And so it's funny because it's bittersweet, but at the same time it's kind of exciting because it made me rethink about why I love public health so much. And like looking at, doing job searching now, seeing all the positions that are out there, it's almost, it gives me like a new, it helps me to remember like why I got involved in public health in the first place. Like seeing that there's so many things out there, there's so many things that I'm interested in, whether it's, health about, ADHD research or, other community health education research, things like that. It's such a wide field. And like kind of like what we were saying before, like all the professional development that's out there, just really, I think it's great for anybody who's, looking at this or thinking about, pursuing a career in public health to definitely, look at jobs that are out there and, put yourself out there. And, I think asking questions like that's something that's, which is, asking questions or advice. I think that's something that's great for people to do. And it's such an exciting field, being able to give back and meet people where they're at. I think that's such a huge and amazing part about public health that we all get to do.
Thank you, Omari. Ashley, what advice would you have?
I would say to always stay open-minded and, willing to learn, but know that one of the best things about public health for me is that no day is ever the same. There's always something, from an educational standpoint that's changing, whether it's research, things to constantly stay updated on in the field. I feel that if you are somebody that, because one of something that we hear a lot here in the clinic, people talking about having the ability to help other people, but what that actually means. And, for me to have been a part of so many different initiatives with the advanced care management and actually implementing behavior change programs and, actually seeing the impact with the community and individuals that are not only advocating for themselves, but, for other people within their community and trying to build the healthy communities overall. So I feel that, if you're somebody that's looking into public health and community health, and you are somebody that is passionate about, not just, assisting with the change and the impact, but, you're somebody that is willing to kind of witness the magic that is, the communities, working together and bridging the gap to better, serve. And it's just amazing. So, that's something that you're passionate about. Definitely reach out to anybody here on this panel. I feel, is willing to talk more about it. But yeah, so.
Thank you, Ashley. And it's a great sort of segue as we wrap things up. So even though I'm only the moderator, I am going to give out a piece of advice because as an educator, I can't not do that when you have the opportunity. And it really ties into something Ashley was just, saying about passion. And that's, I get a lot of students and some of you on the panel may have been one of those who come into my office thinking about changing their majors. So So Ryan, who started out as PA, and Ashley as AT, and Omari as PT, it's not uncommon. We already talked about how young people don't necessarily know what health promotion is or public health is coming into a college setting, and it's not until you're here that you may discover that. And I've had countless students come into my office to talk about what opportunities might be, and for whatever reason that they're looking to do something that wasn't what their plan was, right, when they started. And because I am an educator at heart, I give them a homework assignment. But what I want young people to think about is take a piece of paper, draw a line down the middle. Okay. So make a list of all the things that you're really good at, right? So in terms of academically, like what are the classes you do really well? What are the skills you have? And then think about what you enjoy doing. What classes do you really like? What were your passions? What were you interested in? What was a class you never missed? What was something that really interests you? And then begin to kind of draw these lines that connect those and look for those intersections. And I guarantee you, at the intersection of what you're good at and what you're passionate, there is a job in public or community health. We can find that for you. It is such a wide and expansive field that it really allows for those opportunities. But sometimes they're not always easy to find, or they're not clear, they're not apparent right away, right? I joke, you go to school, for nursing and you become a nurse, and it's a very clear, sort of path, and God bless our nurses, and we're thankful for them, but that's not always for everybody, right? And with public and community health, you go to school for public and community health, but it isn't always a direct, path to what it is you wind up doing. It's not always easy to see. To Amari's point, it's not always easy necessarily to job search. What do you put in that Google bar, when you're looking to find a job? Because all of you have very unique job titles that don't necessarily say, hey, I work in public and community health. And so I think that, for students or prospective students or anybody, back to Antoinette's point about people just changing jobs for so many reasons at various points in their lives this time, if community and public health is something that you think might be for you, then it really is about, what are you good at and what are you passionate about, and find that intersection. And I guarantee that there is something in community and public health that would be for you. So thank you all so much for your participation, panelists and everyone who made this possible, to our sponsor, the graduate programs at Daemen College. For more information about Daemen College, you can visit www.daemen.edu. Keep your eyes peeled for more interactive virtual events coming soon by paying attention to our social media channels on Facebook, on Instagram, Twitter, and LinkedIn. Thank you so much to our panelists and everyone out there for joining us. We appreciate it. Stay safe. Thank you, guys.
Effective leadership has the power to transform individuals, teams, organizations, and the world. That's why it's critical to receive an education that provides a solid foundation. The Leadership and Innovation Graduate Program at Daemen College works to empower students, foster their creativity, and promote collaboration. Students gain the skills that enable them to lead rapid change in an increasingly complex global society. Learn more by visiting Daemen.edu.